So there are a lot of things that you might do. Of course, you might want to decrease things that increase bruising, like the non-steroidals, Motrin, Advil, ibuprofen, aspirin, because when you get the treatment, you get an injection with a needle and it can hit a vessel and it can make you bruise more. So you would like to get off of those products for a while. Also, all of these toxins require zinc. If you don't have zinc, they won't work. I'll tell you a little funny story. In our practice, we tend to treat patients that have a lot of difficulty with getting the right kind of dosing pattern. And so they sometimes struggle to have a good effect. And we were noticing that sometimes people would come in and we would individualize their pattern of injection and they would do well, and then they'd come back again and it wouldn't do so well. And we were kind of wondering why this would be. And I had a medical student who was rotating with me, and she asked me, could this be diet? And I thought that was kind of a foolish question. But the more I thought about it, the more I thought, absolutely, they all require zinc. So we did a study, and we took patients who were established in the practice, and we broke them into 3 groups. Ones that got nothing, ones that got a low dose of zinc that was the recommended daily requirement by the FDA, and then a super dosing of zinc. And we also realized that zinc, like all divalent cations, iron, magnesium, manganese, calcium, zinc, they all have to be taken up and absorbed, and they are all bound and inhibited from absorbing by many of the foods that we normally eat. So very few people can actually tolerate these divalent cations like iron and zinc on an empty stomach. And so they eat food with it. And we wanted to somehow prevent those foods from binding those metal ions. And the way to do that was to give them something called phytase. Phytase binds phytate that is in many of these foods that we eat all the time, whole grains, whatever. For example, if you buy a steak and you eat that steak and you have a half of a whole wheat roll with it, you will bind all of the zinc, all of the iron that's in that steak, and you'll get none of it. If you add phytase at the same time, this special enzyme, it will bind the phytate that's in this roll, and you will be able to absorb the zinc.